Hello, Mr. Holcomb. My name is Bailey, and I'm going to be your nurse today. How are you?
I'm doing good.
Doing well. All right. So it looks like today we're going to be giving you some injections. Can you do me a favor and state your full name and date of birth?
James Carlton Holcomb, 12/21/01.
Perfect. Thank you. All right. So do you have any allergies that I need to know about today before we get started?
I do not.
Okay. It looks like today we're going to be giving you insulin and ondansetron, and I've already double-checked them twice in the MAR, so I'm going to double-check them for a third time with my MIR. So this is the insulin. And it looks like we have the right one, insulin. This is your Zofran or ondansetron, and we have the right one. So perfect, we can get started. So I'm going to teach you a little bit today about your medications before I give them to you. The insulin that I'm going to be giving to you today will help your blood glucose level by decreasing it. Your blood glucose level right now is at 302. So I'm going to be giving you 10 units of insulin. I found this out by subtracting 100 from 302 and then dividing by 20. So I got 10 units, and I already double-checked it with another nurse to make sure that that was the correct units I need to give him. This is a subcutaneous injection, and the common side effects are hypoglycemia, hypokalemia. You can also experience headaches, seizures, fever, hypertension, and nausea. I will be monitoring your blood glucose levels and adjusting them as needed throughout the day, and I will be assessing you for signs of hypoglycemia. After this, your blood glucose level should be decreased and you should be good. The second medicine that I'm going to be giving you is ondansetron or Zofran. I'm going to be giving this to you to prevent nausea. The preferred amount to give you is 4 milligrams, and we ordered 4 milligrams, so we're good to go on that one. This is an intramuscular injection, and the most frequent side effects are headaches, constipation, diarrhea, but you could also experience dizziness, fatigue, weakness, abdominal pain, and dry mouth. I will be assessing you for nausea, vomiting, abdominal dissension. I'll listen to your bowel sounds and monitor your ECG changes. But after you get this medicine, you should have decreased nausea. So now we can get started. So I'm going to start by washing my hands, and then I'm going to put my gloves on. The first one that we're going to give you is your insulin, and I'm going to be using an ampule to give you your insulin. It is a single-use vial, so after I use it, it can't be used again. I'm going to take my ampule and make sure all of the liquid is out from the top. I will break my ampule, set it back down. I will take the insulin syringe, since we are administering insulin, and I will take the cap off. I will put it into the ampule and pull back to the 10 units of insulin that we need, and I'm going to carefully put the cap back on it. So with a subcutaneous injection, we can give it either in the back of the arm, the upper back, the lower back right above the bottom, in the abdomen, or in the leg. We pinch 2 inches of skin, and if I can get a whole 2 inches of skin pinched, I will put it in at a 90-degree angle, but if not, I'll put it in at a 45. On this patient, I'm going to be giving it in the back of the arm because that's where I can get the most skin. So I will take my alcohol pad, and I will wipe the back of the arm. I'm going to get you to relax your arm for me and just let it hang. That's perfect. So now I will take my syringe and I would carefully remove the cap. I will pinch 2 inches of skin, and since I can pinch a full 2 inches of skin, I'm going to put it in at a 90-degree angle. I'm going to put it in on 3, 1, 2, 3. It's in, I administer the medicine, and it's out. So you're good to go on that one. And now I will be doing the ondansetron. I will be giving 4 milligrams, which is 2 milliliters. I'm going to take the 3 milliliter syringe and pull back to the 2 milliliter mark. So I've pulled back to the 2 milliliters. I'm going to carefully remove the cap off of my needle, take the ondansetron vial, and stick the needle into it. I will then push the 2 milliliters of air into the vial and turn it upside down until I have medicine at the 2 milliliter mark. So my medicine is now at the 2 milliliter mark, so I can pull this out. I'm going to put the cap back onto the needle and set it aside for a moment. This is an intramuscular injection, so I will be either giving it in the deltoid, the vastus lateralis, or into the ventrogluteal at a 72 to 90 degree angle. Since this is not a vaccination, I will not be giving it in the deltoid muscle, and the most preferred method is in the ventrogluteal, which is right here on the upper bottom. So for this, I'm going to do the same thing. I will take my alcohol swab, and I'm going to wipe off the area that I will be giving it in. So my alcohol swab down. I will find the area that I will be giving the shot in. I'll put my thumb towards the iliac crest and my hand towards the top of the bottom. And so I will be giving the shot about this area. I'm going to be using the Z-Track method. So I will be pulling his skin to the side as I give it. And I have my spot right here. I will take my shot that has the cap off of it, and I will put it into the patient on 3. 1, 2, 3. It's in. I will aspirate to make sure that there is no blood, and there's not. So I will push it in, and then I will take it out. And I will let go of the skin and let it go back. You can sit down now. I use the Z-Track method just to make sure that no medication comes out after I pull the needle out. And now you have been given your injections and you're good to go. Thank you.